Okay, next we have Ms. Chandra Freeman, Health Policy and Advocacy Manager for Black Health Matters Tennessee.
Good evening. And thank you all so much for being so thoughtful and reaching out in communities to hear from your constituents. So I am Chanda Freeman, the now Director of Strategic Policy, Partnerships for Health Justice. I'm representing the Tennessee Justice Center and Black Health Matters TN. So TJC, for those of you who don't know, provides no-cost assistance with public benefit programs for families from Memphis to the Mountain City. We help families cut through the red tape and legal barriers that often deny them vital services like health care and nutrition. Using what we learn from individual cases, TJC pursues systemic reforms that benefit all Tennesseans. We advocate for public policies that will make Tennessee a more just, compassionate, and inclusive state for all. I'm also here to talk about Black Health Matters Tennessee. So Black Health Matters Tennessee is part of a national movement made up of over 100 organizations across the state and growing. We launched in May of this year, but we've had conversations over the course of the last 2 years to talk about building a cohesive movement to improve health outcomes and champion health equity in Tennessee. So Black Health Matters, again, part of a national movement. It's a statewide campaign that is expected to eradicate the legacy of racism in healthcare. We are hoping to eliminate racial disparities in health. We hope to exterminate state policies that devalue the health and lives of Black families. And we hope to elevate health equity as an urgent priority for Tennesseans. So why Black Health Matters, and why not all health matters? What we know is that when we address the disparities of the most marginalized and impacted community, then by default we address them all. So in the state of Tennessee, Black Tennesseans of all backgrounds live sicker lives and die sooner. Racial inequities subject Black Tennesseans to maternal and infant death rates that are twice as high for the general population, higher rates of chronic illness such as diabetes and hypertension, lower survival rates from treatable diseases like cancer, and lower life expectancy at all ages. These disparities, we know, are not accidental or genetic, but they are the legacy of the racist history that has perpetuated present-day policies and practices. We know that state government policies are denying family health coverage and add to their medical debt, and also restrict access to healthcare resources. Healthcare providers discriminate against people of color in locations that they serve and in the forms of health insurance that they accept. Policy provider bias affects patient treatment. Government fails to monitor and enforce compliance with our nation's civil rights laws. We know that change won't come unless we demand it, for power concedes nothing without demand. So we are here, Black Health Matters, proposing to do this. We're raising awareness among Black communities, healthcare providers, and the larger public regarding the causes and effects of health disparities. We are collecting pledges that will take concrete steps for addressing racism in healthcare and championing equity. We are naming policies that reflect and perpetuate racism, and we're demanding reform of public policy. So we are here today, and while we appreciate the strides that we're making in the state of Tennessee to advance equity through improving health policies, which includes increasing access to healthcare, to oral healthcare services for adults, this year we are thankful and grateful for increasing access to dual services, but we know that that is not enough. We must expand Medicaid in Tennessee, and we have to implement the Affordable Care Act, and that should not be optional. The Affordable Care Act, Medicaid expansion has helped to narrow long-standing disparities in health care coverage and access to care for people in color, and preliminary evidence suggested it is also improving health outcomes. The 40 states that have implemented expansion have made the greatest progress in increasing health coverage since the ACA's major coverage prevention provisions took place in 2014. We know that there are implications for not expanding Medicaid and increasing access to affordable health care. And here in Tennessee, we are over a decade away from the Supreme Court making the expansion, the option, ACA an option. Along with other states in the South, Tennessee should be ashamed. I heard yesterday that Mississippi is the next state in line to expand Medicaid. I remember when we said thank God for Mississippi, and we are not in the position today that we can say thank God for Mississippi. So we are here today to implore you to make health care, increasing access to health care, accepting the Affordable Care Act, expanding Medicaid, and closing the coverage gap, part of the agenda for this year. We are asking you to join us, not just as this is a movement. We know that movements are not monolithic. We know that health is impacted by the social determinants of health, and we are calling on you and folks across the state to join us in championing equity by enacting policies that reduce disparities. So thank you so much for your testimony. For this opportunity. I did bring a handout that I'd like to share with you all.
Perfect. Thank you so much for your powerful testimony, and certainly we'll look forward to seeing that handout with those suggestions. Do we have any questions from the panel at this time? Leader Camper, you're recognized.
Thank you, Madam Chair. Thank you for your testimony. I really appreciate you sharing those facts with us. I also want to take a moment and thank the Justice Center. I remember the Insure Tennessee days and how you all took the lead and brought people up every single day, and we were really trying hard to get that passed so we could expand Medicaid in the state. I remember even some of the legal challenges that you all were very supportive of and were out front in and gave us the things we needed to help fight that. So I'm greatly appreciative of that. You also mentioned, and I want to make sure I have this correct, exterminate state legislation or policies. I'd like to take a look at some of the, I'm ready to exterminate. I'm ready to get the tools out. And I'd like to really see what some of those policies are, if we need to repeal some legislation and what they are. So if you can provide that, that will be helpful as we go into next year. Like I said before, get proactive about it. Right. So that if we know that this policy is a problem, then what do we need to do to rectify that? So thank you for your testimony.
I'll just add one policy that it would be great if we do away with the Kelsey-Durham law. That would be great.
I didn't hear you say again.
The Kelsey-Durham
law, the Lord.
Be great. Great step in the first direction. So thank you again.
For those of you that don't know, that requires the General Assembly to approve the expansion of Medicaid in Tennessee. Unlike in other states, the governor usually can act unilaterally. Senator Campbell, you are recognized.
Let me follow up on that, if you don't mind, Madam Chair, which politicized it. When they did that, it politicized health care in the state. That's exactly what happened. And so we really was trying to prevent that and get Haslam to just act. Just do it.
And we have seen in states that have the ballot initiative or an option for their citizens to lead on that expansion, when given the opportunity, has been enacted every time.
Well, Senator Campbell, then, yes.
Just a question. What is your thought about why the state won't expand Medicaid?
I think it's racism. I do, because TJC has tried to appeal to the moral fiber of our elected officials. We have talked about why it is fiscally responsible, the responsible thing to do, and why it's irresponsible not to. We've talked about the lives that could be saved. We've seen firsthand the impact of a broken healthcare system in the middle of a pandemic, and we are, as a state, poised to see the same thing happen again. And there is no excuse. It has to be racism. In fact, when I look at the map of the states that enacted the Affordable Care Act early on, the map looks like a Civil War map, you know, and it continues to look that way today. So that's my best guess.
Yes, exactly. And I want to add that I also think that we monetize that we have actually developed an ecosystem that has grown around that is very lucrative for certain individuals who are creating workarounds in the form of specific clinics or, you know, but taking up the slack in areas where we have healthcare deserts, that those particular people for those contracts find it attractive. And that's a lot of what goes on in Tennessee state government. So that, I feel like we're up against greed too.
Yeah. Because, I mean, the fact that the Tennessee Hospital Association came out with a report last year saying that 43% of Tennessee's rural hospitals were in danger of closing, I think that that alone should move people, but it is not. There should be accountability and oversight to monitor greed within the healthcare system.
Alrighty, thank you so much for your testimony.
Thank you again.